Good afternoon and welcome to the COVID-19 update on Channels Television. I am Kayode Okikelu and here are some of the highlights. First of its kind in a pandemic year, senior secondary school students across the nation begin the all-important graduating examinations amidst COVID-19 concerns. How far into this battle are we and for how much longer? The Director General of Nigeria's lead public health institute, the NCDC, joins us for the latest on Nigeria's strategy. And South Korea records biggest daily infections since March, most of them linked to a religious center. Thank you for joining us on the program. 298 people have tested positive for COVID-19 in the last 24-hour period. According to the latest data from the Nigerian Center for Disease Control, the NCDC, Nigeria is now almost at the 50,000 infections mark, barely 6 months into the outbreak of one of the most deadly viruses the world has ever battled. 49,068 is the total confirmed cases of COVID-19 in Nigeria. 36,496 patients, or 97 patients, have been discharged, meaning that 7 out of 10 people survived the virus, while 975 of those infected, unfortunately, lost their lives. A breakdown of the 298 cases shows that across 15 states and the FCT, Plateau records 108, Kaduna 49, Lagos 47, Ogun 18, Osun 17, FCT 15, Ondo 14, Edo 8, Oyo 6, Akwa Ibom and Cross River 4 each, Borno 3, Ekiti 2, Bauchi, Kano and Rivers all recording 1. And senior secondary students are currently writing their graduating examinations, and the first hurdle they have to cross is mathematics, in an examination that can be described as first of its kind in a pandemic year. There have been debates over the students' level of preparations and adherence to COVID-19 guidelines, especially for public schools in rural areas. This examination is coming 2 weeks after the federal government announced the safe reopening of schools across the country for students in exit classes after months of a nationwide lockdown. The government also gave directives to state government and school owners to ensure that COVID-19 safety precautions and guidelines are adhered to. And those pictures you're seeing are final year students of Government Secondary School Zone 3, Abuja, Nigeria, with face masks as they sit in a classroom writing their West African Examinations Council exams. We'll head over to Ogun State, where examinations have also commenced. It's talking about the West African Examination Council's WAS across the 20 local government areas of the state. A visit to some of the schools revealed that safety protocols, as instructed by the authorities, were not compromised, as students, apart from using their face masks, also adequately ensured social distancing. Apart from this, medical personnel were put in place, in fact, on standby with basic necessary equipment in case of an eventuality.
As regards the COVID-19, you can say, one, when they came to the school, every day, right from there, we did their temperature, they'll wash their hands, we have the hand washing materials there, you sanitize them, provide sanitizer for the hands. Then we observe the 2-meter distancing. And this morning also, when they came, we repeated the same thing, taking their body temperature using the infrared thermometer, then giving them sanitizers. Then we have the hand washing material there for those who still want to wash their hands. Then, if you go into our exam hall, we have arranged our students there. Our policy here is that 30 minutes before the exam, every exam, the students should be ready. So we have arranged them as at 9 this morning. All of them have been arranged and they are seated, waiting for the exam. And we also have the social distancing there. And you can see that our students are very ready, expecting the questions.
Well, let's now focus on Nigeria's strategy on what was called a novel coronavirus when the world first discovered the SARS-CoV-2 strain which causes COVID-19. And of course, from that moment, we've had to learn and relearn almost every day to come up with the right response to combat this deadly enemy. Today, almost 50,000 people have been infected with the virus so far, with 975 fatalities, but clearly the battle is far from over. So big questions. Where are we in this fight? How long more do we have to go? And what more do we need to do? Well, Dr. Chikwe Ihekwazu, the Director General of Nigeria's Center for Disease Control, joins us this afternoon via Skype. Good afternoon, and thank you for joining us on the program.
Thank you very much for having me.
Well, first, I called it a novel coronavirus, but can we still call it a novel virus after about 6 months of learning and relearning about this virus?
Absolutely. It's still a new virus in the lifespan of viruses. You know, I think why we feel so comfortable with this already, or appear to, is the amount of work and research and effort that has gone into this virus. But, you know, if you think about the emergence of the HIV virus 40, 50 years ago, and how long it took us to get ahead of that curve at the time, how long it took us to even get to diagnostics, to care. We still don't have a vaccine. You will then put into perspective how much we have learned, how much we have progressed with our knowledge base on this virus. So, you know, it's a new era. You know, we live in 24/7 TV cycles, news cycles. Every little bit of information is analyzed ad infinitum. So, you know, it is still a very new virus, but we have learned a whole lot in this time, and that has enabled us respond. And remember, no other virus in the memory of many of us in our lifetimes has led to the economic, political, and social impact this virus has had. So in a way, it's not just a new virus, but it's new because of its impact on our way of life.
Well, there's been so much interpretations as to Nigeria's recent, daily figures. We've averaged less than 400 in the past days, and a lot of people are saying different things about this. But let's get an official interpretation of those figures. Yes, they are dropping. We seem to be testing more, an average of 3,000. So at this point, how clear a picture is this current testing and figures giving us of where we are in this fight?
So, you know, when we present the figures are what they are. And I just need to understand that there are no incentives for decreasing figures. We are a science-led organization at NCDC, and we will present the figures as they are. There have been challenges in some states in testing sufficient numbers. I want to hear on TV congratulate the government and people of Cross River State that have turned around their approach to testing and are now, in the last few weeks, doing what every other state should be doing in testing as many people as possible, because it's only through testing the numbers of people that may have the infection that we can actually understand how widespread that infection is. Now, back to your question, the state that gives us the biggest indicator of where we are is the data out of Lagos State. Why do I say this? Lagos has consistently made the effort to test as many people as possible, and has been responsible. The 50% of the cases initially, now down to about 30% in the country, have been people tested in Lagos. And what we have seen in Lagos, they have consistently tested high numbers. And we have seen a reduction in the positivity rates from close to 30% at the time, i.e., 1 in every 10 people tested was positive for COVID, to right about 10% or less in the last few weeks. So what does that tell us? Fewer people are turning out positive among those tested in areas that are testing sufficiently. Now, we can say that with confidence in Kano, in FCT, in Plateau State, in Borno State. So states where they are really testing sufficient numbers, we can come to some conclusions on where they are. But in any state that is not testing enough, it's very difficult to analyze and interpret their results with confidence.
You know, Dr. Ihekwazu, we have quite a number of points to touch, and we'll see if we can touch on them. But still on testing and what they tell us. Yes, we we have increased our testing, but we're not where we need to be yet. I recall the SGF decrying our low testing per million. Less than 1% of Nigerians have been tested. In fact, about 0.2% of Nigerians have been tested. We have 63 laboratories under your watch, but we're still not doing as we ought to do. So is it rocket science, really?
It's not, my brother, and this is really where we need to come together as a country. You know, the underlying problem with this, people thought it was the labs and the reagents and the equipment, but we are providing all of that. You know, we have scaled the level of testing, capacity to test incredibly. So it is now opening up the big challenges with our health sector, way beyond what NCDC can do. You know, how organized are we in accepting patients into our hospitals, collecting samples from individuals, transporting those samples to the lab, and getting the results back to people. So really what our improvement in the testing capacity has shown is that the challenge, the primary challenge, is not in infrastructure, it's in the system. How do we organize our healthcare delivery system to serve the people? How comfortable, what trust do people have in the system? And that's really what we need to start working on for the future. And that's my challenge for all of us as a community, private sector, public sector. You know, it's very easy for us in Nigeria to throw money at problems. And the federal government, our partners, we've all put in the resources. And I'm confident that we will have the biggest transformation in our laboratory capacity in Nigeria ever. But what it will not change is the attitude of our people to have confidence in the health sector, which means that we have to rethink bottom up how we are providing health services to people so that they can have the confidence to come to hospital, offer you the sample, and are confident that that result will get back to them. So it's the softer things. And that's my challenge to my team and the rest of the sector at state and federal level, because most of this work happens at the state level.
Right. Just briefly on that, are you implying that people are not confident enough to come forward for testing?
70% of Nigerians access their healthcare in the private sector. There's a reason for that. We need to work very hard, and that is what we're working on. People are not coming forward in sufficient numbers to get tested for all sorts of reasons. So we are working very hard to bring the sample collection centers closer to the patient. We're working with secondary and tertiary facilities across the country so that anyone that gets into a hospital can have a test done if they need it. So we have to work together. This is no longer a question. This is a marathon. It's not a question of blaming NCDC. It's really thinking as a nurse, as a doctor, you know, as a leader of a state ministry of health or as a federal medical center, what can we do collectively to increase the confidence of the services that we provide so that patients can come in and get tested as they need?
Okay, we'll touch on vaccines and the conversation around that in a moment. But I recall earlier on in this, journey, if I can use that term, there were predictions about Nigeria, Africa as a whole, saying if Africa is not careful, you might see dead bodies lying on the streets and other predictions. Thank God that has not happened. But there's a challenge here with people thinking, well, this is done and dusted with. We can move on with life. Just how much of a challenge is that? And what are you doing really to turn that around?
So, I mean, the first thing to acknowledge is the incredible effort that has gone into this response, from the leadership provided by the Presidential Task Force to the Minister of Health and to the federal government under the leadership of President Muhammadu Buhari. Sometimes we think that bodies not lying on the streets is just because we've been lucky. No, there may be some aspects of luck, but we must also give credit to the response that has been mobilized to prevent us from getting to that place. Now, where do we want to ultimately get to? The two strategic goals I think this government has in terms of this response. One is to control and manage the outbreak itself. But one is to build a health system that will prevent us from being as vulnerable as we have been to the impacts of this one. So in terms of the vaccine, there are global efforts happening. We're participating in it, but not playing the big role that we think we should be playing as a country the size of ours. And that comes to some underlying investments that we have to make in terms of encouraging people, more people to go into science. You can't wake up one morning and say, I want to make a vaccine in 5 years.
Right.
This really takes generations of investments in science.
Okay.
It's almost like developing a love for a subject that we need to survive.
Right.
And that's a rethinking at the societal level on the country we want to create in the future. And we should have started 50, 60 years ago.
Dr.
But the next
Ehekwazu,
best time is now.
I'd like you to hold your thoughts, please, for a moment so we can go to break and come back to this, discussion around vaccine and what Nigeria is doing to ensure we're not last in that race. But we'll go to break now. And when we return, a church in South Korea is said to be responsible for the largest daily cases of COVID-19 since March. We have more on this when we return. Please stay with us. Welcome back. Well, let's rejoin the DG of Nigeria's Center for Disease Control, Dr. Chikwe Ehekwazu, who joins us via Skype this afternoon to discuss Nigeria's response so far and what we need to do. So, Dr. Ehekwazu, just before we went on that break, you were talking about, vaccines, and there's been a lot of talk about that. And a lot of Nigerians are, really waiting to see how Nigeria plays this such that we at least get the best from the best. So there's the Russian option, the other countries, India, the United States, there are private, companies developing vaccines. What is Nigeria's strategy? Who are we talking with? Who is likely to partner with Nigeria on this?
Okay, so the various levels of the engagement in vaccines, we're doing it as a continent through the African Union and Africa CDC, and through our various partners, CEPI and Gavi. These are multilateral organizations that are working collaboratively to ensure that there's a global strategy. You see, the current moves by some countries to nationalize access to vaccines is actually not a good one. We want equitable access to people because vaccines are a life-saving product, and we need it not to be defined only by the countries that have the most wealth to acquire the vaccine. So we're engaging at different levels. The good thing in Nigeria is that we have an agency, the National Primary Healthcare Development Agency, that has for many years succeeded both through routine immunization and campaigns to deliver life-saving vaccines to children across the country. We're just on the verge of, we've just eliminated polio, a few months, and that will be acknowledged globally, and the continent will be declared polio-free. So we have a lot of experience in delivering vaccines across the country, which we will leverage once a vaccine becomes available to all of us.
Well, and we wish you the very best in that. I'd like to thank you so much, Dr. Chikwe Ehekwazu, the Director General of the NCDC. Thank you for sharing your thoughts with us on the program.
Thank you for having me.
Well, the Southeast region and Igbos generally celebrate what is called the August meeting about this time yearly. But the COVID-19 pandemic has hindered this year's celebration because this event no doubt may increase community transmission. Our correspondent, Eyitope Kutei, went round some rural communities in Imo State to feel their pulse.
Though the race is still on to find both therapeutics and vaccines for the COVID-19 pandemic, and while this search is still on, some medical experts believe curbing the community transmission is one of the major ways to contain the spread of the coronavirus disease. Earlier today, we went into some remote communities in Imo State to get the thoughts of indigents on their knowledge of the community transmission and measures being put in place to contain the spread of the virus, and to also ascertain if they've been adhering strictly to all the NCDC COVID-19 protocols.
They using our face mask and avoiding observing social distancing. You create gap. You don't avoid gathering. So where there's people gather, you avoid it.
Community transmission is when once that is infected with COVID-19 virus got contact through somebody that is held in the community, and from there it starts spreading from one person to another. But there are guidelines marshaled out by NCDC to wash and sanitize your hand, as you can see, I'm wearing my face mask, limit public gathering, limit where you go, except areas that a place that you must go.
The people also believe that to a large extent, the COVID-19 pandemic has affected the annual August meeting being celebrated in their communities. We'll continue to bring you up to speed with events and happenings around here as it concerns the COVID-19 pandemic. From Owerri, the Imo State capital, Eyitope Kuteyi, for COVID-19 updates.
Olani Ayodeji is a pharmacist, a member of Pharmaceutical Society of Nigeria. She joins us via Skype this afternoon to discuss issues surrounding non-pharmaceutical procedures, even pharmaceutical procedures in this fight against COVID-19. Good afternoon, and thank you for joining us.
Thank you for having me.
Well, I imagine that there's been a lot of pressure on pharmacists generally, people looking to you asking, what do we do? What kind of drug do we use? When is a vaccine going to be ready? And I wonder, how do you handle all that? What do you tell these patients, for one?
We're glad that vaccine production is improved to combat this pandemic. It's a good thing because if there's no vaccine, then vaccine production takes about 7 years to come up. But now WHO and other countries all over the world have established to ensure that production of vaccine is available at least in the next 15 within a matter of months. To make sure that vaccine availability is ensured. So there are various stages of clinical trials to make sure that this vaccine is available. Talking about the Russian vaccine now, WHO, there are various stages of clinical trials to ensure that safety and efficacy of the vaccine is ensured. So actions have been expedited to ensure that whatever you are presenting to the public is of the required efficacy and safety is ensured.
Just one more thing. I understand you've been involved with diabetes research. Incidentally, it's prevalent in this part of the world, and it's a comorbidity that makes COVID-19 fatal. So how does COVID-19 really affect diabetics? Because I know a lot of people are interested in that.
Thank you. COVID-19 affects those with morbidities, those that have chronic conditions. It affects them severely. We talk about those with diabetes, those with hypertension, those that are immunocompromised, those that are on immunosuppressant drugs. So for those population, they are vulnerable population, and the use of vaccine in them. Vaccine is initially tested in healthy population, then you test it also in people with comorbidities because they are vulnerable. So vaccine is made available to, when the vaccine production is available to the public, it will be made available to the vulnerable population first, to those in front line, taking care of infected people, to the elderly. So the elderly now, they've been asked to stay away to ensure physical distancing.
Right.
As well as every other person.
Right. Thank you so much, Mrs. Olani Ayodeji, a pharmacist and a member of the Pharmaceutical Society of Nigeria. Thank you for those insights this afternoon.
Thank you.
Well, authorities in South Korea are accusing the leader of a church of ignoring coronavirus restrictions, including organizing a large anti-government rally on Saturday when gatherings are still not permitted. In two complaints filed by authorities, Jun Kwang-hoon is also accused of obstructing testing of church members by refusing to provide a list of followers. As a result, the country has now recorded 300 new infections, the worst ever in 5 months. We'll take a look at our website, channelstv.com, which has the latest updates on the pandemic. And all you need to do is log on to channelstv.com and you have access to stories like this one. Nigeria records 298 new COVID-19 cases, and you see a breakdown of those figures across states and so much more, all at your fingertips. Well, that's the COVID-19 update for this afternoon. Thank you for watching. I'm Kayode Okikiolu. To stay healthy and stay safe.